Yeah, I'm sure some of you must have experienced some sort of a burning sensation, tingling, numbness, paresthetica, coldness, which would be present in the lateral, on the side of the thigh, or maybe in the anterior front part on the side of the thigh, especially on prolonged standing. This condition is called Meralgia Paresthetica, or compression of a nerve called lateral cutaneous nerve of the thigh. It's quite common. It's said that it occurs in around 50 out of 1 lakh, and in diabetes it will be found in 250 per lakh. That is, it is quite common in diabetics. This condition is supposed to occur at any age, but usually 30 to 40 years. That is the most common, more in males, and those who are obese, more than BMI of more than 30, those who do regular exercise, especially weight lifters, or those who gain recent weight, or those who lose weight also, it's quite common. And it's common in the people in military, in the soldiers, in the policemen, who use a tight, uniform, tight belt and all, and in young people who use a lot of jeans with the tight undergarments. So these are the particular people who are prone to have this condition called Meralgia Paresthetica. This is described by Bernhard Roth in 1880s, but this condition is quite common. And as I mentioned, the more characteristic symptoms that whenever the person stands for some time, they get excruciating pain, paresthesia, numbness, tingling, coldness in the side of the lateral or outer aspect of the thigh, either on one side or on the other. And this usually gets relieved on sitting for some time. This is not a very dangerous condition, but it's a disturbing condition that would make you uncomfortable whenever you stand for some time, because you would get some sort of a nasty feeling, some sort of a pain, tingling and all. So as I mentioned, there are many causes which would masquerade like problem in the lumbar disc or lumbar canal stenosis, or sometimes there is some problem in the plexus. There is one area called the lumbar plexus, some problem there like plexitis, infiltration or hematoma or abs or something which would press multiple nerves. Sometimes this nerve may be trapped there. There are many entrapment disease of the nerves. The nerve may be entrapped here, then you would call it as a carpal tunnel syndrome. There is a cubital tunnel. There is this many areas in the upper limb, the lower limbs. But this condition, this particular nerve, that is the lateral cutaneous nerve, is compressed at the level of the part of the pelvis called anterior superior iliac spine. So the end result is that you get only pain and some loss of sensation. Nothing would occur beyond that. There is no weakness. The person can walk, do all sort of activities, but excepting for the pain, he is absolutely fine. But always you should look for any history of diabetes, whether patient has any hypothyroidism, recent weight gain, or some other condition which would cause this sort of symptomatology. So the investigations largely, you can ask for a nerve condition study, or maybe some ultrasound which would look at the shape of the nerve and all. But otherwise we don't require much investigation. And the treatment is also quite simple. That is, you reduce weight, you control your blood sugar, you control your hypothyroidism, or any other condition which would suppose if the person is in the habit of using tight belt, tight jeans and all, he should release it a bit further, so that it shouldn't cause undue compression on the exiting nerves from the pelvis. So that is one aspect of this: reduce weight, do regular exercise, and you can use simple medication and NSAIDs and other neuropathic drugs which is commonly used for neuropathic medications. Okay. Yeah. So the differential diagnosis, you should be careful. Sometimes all the pain in the distribution of the lateral thigh may not be Meralgia Paresthetica. Sometimes this may be part of a lumbar disc or a IVDP, or this may be part of a lumbar canal stenosis, or maybe something like a lumbar plexus lesion or infiltration. So you should be a little careful whenever you should examine. Here in this condition, the numbness or the sensory impairment is restricted to the nerve distribution, the lateral or the outer aspect of the thigh, either one side or on both sides. And once you know that this is that particular condition, you can treat by conservative medication measures, reducing weight, and you should avoid any inciting factors which would cause this particular condition. And if there is no relief, then the next thing would be, you can have a local lignocaine steroid injection at the nerve exit from the pelvis at the region of the anterior superior iliac spine. And they can use a radio frequency ablation or even a surgical release of where the nerve is getting trapped, and any inciting factors, when any aggravating or precipitating factors has to be addressed, otherwise this would recur. So as I mentioned, this condition is quite innocuous but frustrating or distressing. So you have to find out, especially if you are in the habit of using a tight underwear, under clothes or belt, you should try to have a moderate, that should be in moderation, and any factors which would exacerbate has to be addressed, and otherwise it's a quite innocuous condition. So this particular condition, Meralgia Paresthetica, is quite common, and if you treat it nicely, I think it's quite an easy one, you don't have to worry much. Okay, so if you have got any queries or doubts on this condition Meralgia Paresthetica, you can comment. Thank you very much. Bye.